If you want a two-tiered health program, then just continue the way we're going. And I remind you that in this movement we pledged ourselves 50 years ago that we would provide health care for every man, woman, and child, irrespective of their color, their race, or their financial status, and by God, we're going to do it.
My name's Brigitte Dupap.
Awesome, and we can all remember Bridget from her heroic moment standing in Parliament with the Stop Harper sign. I don't know how you feel about this, but I almost feel like when I'm talking to somebody from the States or for another country and we're talking about what it's like to be a Canadian, often one of the things that I'll hear from them would be healthcare. And it's almost like it's a piece of our identity that might become missing soon.
That's a really good point. And you think about someone like Tommy Douglas, right? He was named as like the greatest Canadian because of his role in creating universal health care for everybody.
Hey, Peter, what's going on here today? Why are we all here?
Well, here we were trying to raise the alarm for local citizens of London about the very critical situation we find our hospital services in. And quite frankly, we chose this site simply because it is a medical hall of fame. It's apropos that Tommy Douglas is enshrined here as the father of Medicare. His idea, Medicare, universal public health care, administered publicly, access for all, that was enshrined here.
We shouldn't have a person dying, as in a recent case of a patient with mental health issues who could not be saved simply because we are so overwhelmed in the system.
Shame.
This is a true shame. This is a hall of fame, not a hall of shame, people.
And it's true that it is something that people take pride in, and to see it being eroded, it's really heartbreaking. But it's also possible to turn things around.
There almost is not one hospital that isn't feeling the cuts. And you can't freeze those budgets indefinitely without noting that there's going to be code gridlock. Having the hospital services that we just do enjoy still, to the point where people are over 100% capacity, such as the London Health Sciences is. We had 2,000 more beds 20 years ago than we do now. How does that make any rational sense?